It was really a difficult decision to make because different doctors were telling me different treatment options for my breast cancer.
Not that I didn't trust my doctor. She's an amazing, amazing oncologist. Her first recommendation right off the bat was, like she's done with all her patients, radiation and chemotherapy.
I talked to the doctor who was going to give me my surgery, and I kept asking him whether I would need chemo, and he would never quite answer that question because he didn't know.
And when my mother had breast cancer, she had to do the chemotherapy, and it didn't go very well for her.
There just wasn't a clear path, and there were too many things that were open.
She said, well, you know, there is something that I have heard of that we can offer you, the Oncotype DX, and if you're willing to try it, then let's do it. And I said, yes, I'm very willing to do it.
Maureen came into the picture with knowing about the Oncotype DX. And as she said, it tests the cancer cells and would help me determine whether I needed chemo or not.
I was reading the Wall Street Journal, and I read about this new test, Oncotype DX, that I thought was pretty interesting, so I just brought it home. I brought the article home to Catherine to see if she could take a look at it.
I could hear him say, there's good news. Your test scores show that you would not benefit from having chemotherapy, so you don't have to have chemotherapy.
And the doctor called me in and gave me the results right there in the office. Chemotherapy wasn't necessarily the best course of action for me.
I had the choice of not doing chemotherapy, but when I found out the results, there was no question in my mind I would do chemotherapy. I accepted it and just moved on.
We want to get the word out so other people will know, other women will know that this test is available to them.
So they can pass it on like Maureen did to me.
You have a choice. There is a choice when it comes to breast cancer treatment, and I want every woman to be aware of that.